A rhinoplasty or nose job is a procedure that can be performed to correct the way that a nose looks or the way that a nose functions. Oftentimes patients present to the office asking what can be done to make their nose look different. In different patients' eyes, this can mean different things. Sometimes patients will notice they have a large bump on the top portion or the bridge of the nose. Sometimes they'll notice that the tip of their nose is too wide or a little bit asymmetric. And sometimes they'll notice that the tip of the nose is either rotated too high or too low, or it projects outward too far from their face, or does not have enough projection. In this case, a rhinoplasty is a procedure that can be used to correct some of these different issues. In the examples I just mentioned, the bump that is on the bridge of the nose can be taken away. The nose can be made slightly more narrowed. If the nose is rotated too much, it can be under-rotated. Or if the tip of the nose is projected too far, it can be brought back slightly closer to the face. All of these can be tailored to a patient's preferences, as each of these are specific to an individual on their own. Typically, the procedure is performed in the operating room under general anesthetic and can last anywhere from about 1 to 2 hours. This typically is done with a small incision across the front middle portion of the nose and then into the nostrils themselves, so most of the incision is completely hidden. After a week, the patient returns to the office to have their dressing removed and have their sutures taken out. At this point, they continue to recover for about a week or so. There's typically some swelling present in the nose that can last up to several months or even a year in some situations. In addition, rhinoplasties are also done in combination with septoplasties, or reduction of the inside portion of the nose called the inferior turbinates, to help patients breathe better. Typically, rhinoplasties are performed for cosmetic reasons, but sometimes this is done for what is called a functional reason, or to make patients breathe better.